In this case, history. Uh, Answer the following question. Class, our learning objective from this lecture: what are the main symptoms is present? Check for danger. So, any general danger sign as previous. How can you treat convulsion? Can use give diazepam rectally. You draw up if high. If the child is able to sugars, how can you make sugar water? So now how can you? So what could be the sign and symptom of infection? Does the child have cough? So first we ask the some definition. We can the difficult breathing refer to definition. Chest syndrome. When the child what wheeze? How can you define wheeze? It's a soft mute. How can you define fast breathing? This is should or fast breathing. So any danger sign or pneumonia. What's our job of treatment in this context? Third grades, if the baby has manage this patient. We give appropriate antibiotics for 5 days. In case of pneumonia, if the patient was given antibiotics, so how can we deal with this patient? If the baby come with this condition cough, children with wheeze and no general danger, if the chest syndrome persists in spite of bronchodilation, if the baby have no fast breathing, no danger sign, only have wheeze. In the last we was talk about the child from and